My name's Corinne Young. I'm a nurse practitioner. I work at Colorado Springs Pulmonary Consultants. I've been in pulmonary for about 13 years, and we have quite a large COPD population.
Hi, I'm Carol. I'm from Colorado Springs, Colorado, originally from Minnesota. I was diagnosed with alpha about 4 years ago. I'd heard of a couple of acquaintances that had had it, but really didn't know anything about it. So when I found out when I had alpha, I was like shocked. Didn't realize it could happen to me.
She was sicker than everybody was telling her. That she now had a reason to feel the way she felt. You know, that changed it from being out of control with this disease to now I know what it is and now I'm gonna tackle it.
I felt vindicated.
Yeah.
I was really, really sick. And it was like no one knew how sick I was. And I was gonna do something about it.
It's important to screen them because you're not gonna find them any other way. The only way to know is by screening. You know, they look the same, they smell the same, they walk the same, they cough the same, they have all the same symptoms as your other COPD patients. The only way to know is screening. I
saw at least 3 or 4 doctors and a couple of nurse practitioners, been to 2 ERs. And then when I finally went to pulmonary rehab, that's when I heard about alpha-1. And they were kind of nonchalant. They're like, we're gonna test you for alpha-1. 1 in 100 that you have it.
That feeds the need to continue to screen because there's a lot that you have to go through before you find one, oftentimes, and I think that frustrates a lot of providers because they feel they're not out there or they're not in their population.
So 2 weeks later, they go, Carol, you have it. And it's like,
I tell them, you know, good news, bad news. We found a reason why your COPD is more aggressive than it should be. And what it is this genetic deficiency. The good news is that we can also offer you other treatments that would not be available to you had you not had this deficiency. I always want to put the patient first and what's going to benefit them the most.